Hello everyone, so this video is about interpretation of OPG. As we all know, OPG is the most primary radiograph that we advise for our patients, and when we talk about oral and maxillofacial surgery, definitely it is going to help us in diagnosing various pathologies, like ranging from your cyst to tumors to third molar surgeries, everything. So as I told, that is the most primary radiograph that we advise for our patients, but it is often seen that we might miss out some of the soft tissue or some of the spaces in it or some of the minute anatomical landmarks. So this video is complete elaboration of your anatomical landmarks of the OPG, including the soft tissues and the hard tissues and the spaces. Talking about anatomical landmarks of OPG, we first divide it into two parts, that is the maxilla and the mandible. Maxilla in itself has got almost about 21 landmarks, and mandible has almost about 19 landmarks. So let us start with maxilla first. You see this radiopaque structure present here is nothing but your mastoid process. Spinous process is coming out of this mastoid process, or you can appreciate here is nothing but your styloid process. A radiolucent circular part present just above the mastoid process and behind the glenoid fossa is your external auditory meatus. We change to a much better picture. So this cavity present here is glenoid fossa, and followed by you have articular eminence. Just behind the articular eminence we have a radio opaque shadow kind of structure, which is nothing but your lateral pterygoid plates. Now this radiolucent line is making a teardrop shaped appearance. Okay, so this is nothing but your pterygomaxillary fissure present. This as a whole is a zygoma. The parts of zygoma lies, this is the zygoma, this is the zygomatic arch, and this is the zygomatic process of maxilla. A smudge like area over the maxillary molars is nothing but your maxillary tuberosity. This lining present above the first molar is nothing but your floor of your maxillary sinus, and this whole thing is your maxillary sinus. This is your orbit, and just beneath the orbit you have one more radiolucent structure, which is nothing but your infraorbital foramen. Next you have this radio dense line present here, that is nothing but your hard palate. This is anterior nasal spine followed by the nasal septum. This is the nasal cavity, which is radiolucent, having the nasal conchae present between. The incisive canal and the foramen lies just between the two central incisors. And then we have here somewhere we have got hamulus present, and these are nothing but your dentition in your maxilla. So these are about your maxilla. While when we talk about mandible, this is the condylar process present, the coronoid notch, the coronoid present. Okay, this is your mandibular foramen, and from that mandibular foramen you have this mandibular canal present here. Then you have this whole structure, this whole rectangular structure is your ramus, while this is the inferior border of your mandible. Here if you can appreciate it closely, okay, you'll be able to see that there's a radio dense line present, which is nothing but the internal oblique ridge, and just behind that you have external oblique ridge or the mylohyoid ridge present. Here somewhere in between these two incisors we have got geni tubercles, and here that split bone which can be appreciated is nothing but your hyoid bone. This is the angle of the mandible present, and these are the dentition that are present in your mandible. Now talking about the soft tissue landmarks, if you can see, first of all starting with your tongue. Now you can see that here somewhere, okay, here somewhere is a radiolucent shadow present, that is nothing but the shadow of your tongue, which usually overlies the maxillary teeth ranging from your first premolar to your molar, while the shadow or radiolucent shadow that is overlying your hard palate and the roots of the maxillary teeth is nothing but your soft palate and uvula. Here, a crescent shaped radiolucent line can be seen, which is nothing but your lip line. And here you have this over the condylar process, or just behind the condylar process. Here you have ear present. Okay, talking about the air spaces, we have three air spaces as whole. Here, just behind the palate, we have got palatoglossal air space, continuing as the nasopharyngeal airspace, which further continues as glossopharyngeal airspace. So, this is all about your landmarks of the OPG and the soft tissues, the bony landmarks, the soft tissues, and the airspaces. Thank you for watching it.